Understanding Dementia and Delirium, Lewy Body Dementia. In this short presentation, you will learn what Lewy Body Dementia is and the common signs and symptoms. Here are some facts. Lewy body dementia is caused by Lewy bodies, which are abnormal proteins inside the brain cells that cause the death of the brain cell and deterioration of how the brain functions. At present, we do not know what causes Lewy bodies to develop, and they're named after Dr. Friedrich Lewy, who first discovered them in 1912 under the microscope lens. Lewy body dementia has similar characteristics to Parkinson's disease, and people with Lewy body dementia characteristically experience swings in their level of alertness, fluctuating from clarity to confusion, often within short periods of time. So you may find that one minute you could be talking to someone and they are appearing very lucid, very clear in their thinking, in how they are, to then becoming very suddenly confused. So they really fluctuate between their conditions from moment to moment. They're very likely to experience visual hallucinations. They typically may see people and animals, and these can be very vivid. And hallucinations are things that aren't actually there. The person is experiencing things that aren't actually real, but they are real to the person. Although the person may have other Parkinsonian symptoms, the tremor associated with Parkinson's disease is not always present. A diagnosis of Lewy body dementia can be very difficult because it shares some of the symptoms with Alzheimer's disease and Parkinson's disease, and so it requires an experienced specialist to diagnose, such as an old age psychiatrist, a geriatrician, or a neurologist. As I mentioned earlier, the person may experience marked fluctuations in their symptoms from one moment to the next, especially when it comes to attention and alertness. This can present as them appearing to have, again, as I mentioned, full clarity of thought and mind one minute to being confused the next. They may have changes in mood, and again, due to the damage in the brain, but also due to how they're experiencing their world. And another very common issue with Lewy body dementia is sleep disturbance. They can often move and thrash and talk in their sleep and can often act out their dreams. The person may also experience delusions and misperceptions, that's misseeing things. So a delusion is a mistaken belief, an idea or interpretation of something, such as somebody's stealing from the person, or somebody's taken their things, or they may believe that they need to go and pick up their children from school. And a misperception is how they missee. So as I've mentioned in other modules, if we look at a black round rug on a floor, the person may actually see that as a hole in the ground. So that would explain why they wouldn't go and walk on it. Another thing a person who has Lewy body dementia may experience is a loss of smell and taste, and that can sometimes be one of the first things that they actually go to see the doctors about. They may experience rigid muscles, so this is what we call the Parkinson symptoms. They become slow in their movement, their muscles become very stiff, and they're at very increased risk of falls. They may often have fainting or funny turns as well. And they may have changes in what we call visuospatial awareness. That's awareness of your position in distances and shapes of objects in that space. So for instance, if somebody handed you a cup of tea, you might not actually be able to judge how far the cup is away from your hand. two very important things here is the person with Lewy body dementia is far more prone to delirium, which we'll explore later on. Delirium is a serious, rapid disturbance in mental abilities that affects awareness of the environment where the person is around them, and they can become increasingly confused in a very short space of time. This needs medical attention urgently. Also, something to bear in mind is that traditional antipsychotic medications that have often been used are actually very dangerous to use in someone who has Lewy body dementia, because they can set off severe reactions and may actually double or triple the rate of death in patients who have dementia and Lewy bodies. So this very short presentation has helped you understand a bit about what Lewy body dementia is and the common signs and symptoms.